are you sleeping? Are you sleeping? I'm Dr. Shelby Harris, Director of Sleep Health at Sleepopolis, and this is Sleep Talking with Dr. Shelby, the show that dives deep into all things sleep so you can get the rest you deserve. Today, we're answering sleep questions sent in by you, listeners. But first, maybe you should sleep on it. That's the expression, at least. But is there actually truth to the old adage? According to a study at Duke University, yes, sleeping before a big decision can help us make stronger choices. For the survey, researchers at Duke staged a garage sale, asking participants to rummage through boxes to guess the most valuable one. Again and again, same-day decisions favored boxes with enticing top layers, even if other boxes held more valuable items. We found people are strongly biased by first impressions, said lead author Dr. Allie Sinclair. However, participants who slept on it no longer favored first impression boxes. Instead, they recognized boxes with more valuable items below the surface. This is an exciting look at how our brains summarize a rewarding experience, added Dr. Allison Adcock. When it's over, our brain knits it all together in memory to help us make better choices, and that neat trick happens overnight. What do you think, listeners? Have you ever had a big decision to make and slept on it? I know I have. I sometimes will actually say to myself, if I really feel, how should I say, if I feel kind of that I want to make an impulsive decision, or I feel pressured to make a decision, but I really don't have to make that decision that night, I actually do allow myself to sleep on it. And there's something about that sleep overnight that helps bring clarity to the decision-making process. And I just feel so much more comfortable in what I decided to do. So I encourage you at some point to just sleep on it. See what happens if it's nothing that has to be decided upon immediately. If you like Sleep Talking with Dr. Shelby, take a second to follow or subscribe on YouTube, Spotify, or Apple Podcasts. It seems simple, but it helps us reach a lot more people to get them the rest they deserve. Listeners, this episode of Sleep Talking with Dr. Shelby will be our last regular episode for a while. Over the last year and a half, it has been our pleasure to premiere new episodes every other week. Going forward, you can stay tuned for special episodes and bonus content, but for now, we'd like to leave you with one last Sleep Talkin' to answer the questions you want to talk about most. So thank you, listeners, really, truly, for posting these questions on my Instagram at SleepDocShelby and for tuning into our season finale of Sleep Talking with Dr. Shelby. So here are the first few questions. I got so many from you to answer on the podcast, but the four that I have today are really some of the ones that I get asked often. So I really decided to go with those today because they are pretty common questions. And I would assume if a lot of people had asked them on Instagram, then a lot of you who are listening probably have very similar questions yourselves. So our first question comes from Lynn B. of San Francisco, California. Hello, Lynn. Thanks for listening. Lynn asks, how do I get back to sleep at 3 a.m.? Every night I wake up at the exact same time. So usually it's 3 a.m. Sometimes it's 2 a.m. But yes, Lynn, this is a super, super, super common question. And there's something almost uniting amongst people about that 2 or 3 a.m. awakening because so many people have it. So there's a few things that I always think about when it comes to that awakening, always at the same time. So the first thing is if you're someone who typically is pretty good about your sleep-wake schedule, so you go to bed around the same time, you wake up around the same time every day, then believe it or not, a lot of times that awakening, if it's always at the same time, for a lot of people can be when you're completing a sleep cycle. So when you go to bed at night, you cycle through, you kind of go into this, we call it stage 1. It's this in-between stage of sleep. You're falling asleep. Then there's stage 2. Then there's deep deep sleep, which is stage 3, and then you go into REM sleep, which is that very active sleep. And then you actually have a quick awakening, and then you fall back asleep again, rinse and repeat. As the night goes on, you spend less percentage of time in deep sleep and more percentage of time in REM sleep, but you still have those cycles through all the stages throughout the night. Now, the thing to keep in mind is when you finish each sleep stage, usually it's about 90 minutes, give or take. It's not exact for everyone. But if you finish a sleep stage or a sleep cycle completely, guess what? Oftentimes it's around the completion of a full cycle. Then you wake up. And then what happens is that people then almost pathologize that awakening as if, oh gosh, I'm awake. Why am I awake? I shouldn't be awake. I should be asleep all night long. But the reality is that it's totally normal to awaken after each sleep cycle. And believe it or not, we have 4 to 7 sleep cycles throughout the night. So that means there's generally either you go to the lighter stage of sleep or a complete awakening 4 to 7 times a night. It's just usually when you have it, you have amnesia for it. But if you're someone who has that quick awakening and just knee-jerk reactions as, oh gosh, this was terrible. Why am I awake? I should be asleep. Kind of the process that most people do is they look to their side, they look at the clock, and then they clock it in their head and say, oh my gosh, it's 3 a.m. And so then you're almost, like I said, pathologizing. You're making it a problem that you're having that awakening. So the first thing I always encourage people to do is to not necessarily go to, oh, this is so terrible that I wake up. Try to not embrace it, but just say, okay, maybe this is just part of me finishing a sleep cycle instead of going to that knee-jerk reaction of, oh, this is such a problem. So if you can do that and also not look at the clock throughout the night, you've also trained yourself to look at the clock and you're kind of confirming that it's always happening at the same time. If you can do that, that actually helps to give you a better relationship with those awakenings so that it doesn't become so problematic. You wake up, you don't look at the clock, you fall back asleep again. You don't make it to be such a problem. Now, if you wake up always at the same time and you have trouble going back to sleep, or it's really a problem, it doesn't feel like it's really completing any sort of a sleep stage or sleep cycle, then we also want to think about other things. So are there things like I don't know, like eating at night? Are you not eating before bed? Are you waking up hungry at night? Are you always having to use the bathroom around the same time? So are you someone that's drinking liquids before bed? Are you, believe it or not, I see this with some people who do intermittent fasting. So they're actually having essentially like low blood sugar. They're waking up because they're hungry because they haven't eaten for a long amount of time. So that's another thing to think about. Is there any snoring, sleepwalking, kicking of your legs, anything like that that tends to happen around the same time at night that might be causing that? And then another thing to think about could be hormonal changes. So we often see, women will often say around the time of perimenopause and menopause, they wake up because they are having hormonal hot flashes, night sweats. And so what do? They look at the clock, they start worrying that they're awake. So that clock watching, kind of keeping a time on it, can be problematic. That's also the trackers we've talked on here on our podcast that we did a while ago with Dr. Kathy Goldstein. Trackers can be helpful, but sometimes they just make you more hyperfixated on some of the patterns that are already happening. And if it's not making any change, then if it's not really changing how you're sleeping at night, then it's only making you hyperfixated on these awakenings, which might not be helpful either. Now, if you're someone who wakes up in the middle of the night around the same time, even if it's finishing a whole sleep cycle, but you can't quiet your brain down, you're waking up because of a busy brain, rumination, anxiety. A lot of people are suffering from anxiety and stress right now. Then my favorite suggestion, and we had an episode where we talked with Dr. Jason Ong on this, is meditation. And meditation practice during the day, 5 minutes even, where you're practicing meditating and being mindful to let thoughts go. And when they go, if you're not able to be focused on whatever it is that you're trying to think about for the meditation, if your mind then wanders, let it go and refocus. Let it go, refocus. Remember, the letting go and refocusing is what helps strengthen your brain so that you can be better equipped to let things go in the middle of the night when the stakes just feel so much higher. So practicing meditation daily, as often as you can for just 5 minutes, can help with those 3 a.m. awakenings. And then two other things that I always suggest. So one thing is the amount of time that you're spending in bed. So if you're in bed, let's say 8 hours a night, but you're only sleeping 7.5 hours, if you spend a little less time in bed, maybe you limit yourself to 7.5 hours every night, you might still have that awakening, but you might not be up for as long, or you might have more amnesia for that awakening. It might just be so quick you go back to sleep. So consider spending consistent sleep-wake schedule, but spending a little less time in bed can be really, really helpful for that. And then my one last suggestion for this is if you wake up in the middle of the night and your brain is, I say this all the time, it's on fire. You're getting frustrated because you're awake and you're like, oh, I'm always up at the same time. Or you're just worrying about things, ruminating about things, frustrated that your significant other is asleep next to you and you can't sleep. That's when you want to consider, or one other thing, you're also lying there and you're trying to force sleep to happen. Get up, go do something else to pass the time. Try to stay away from screens because they have clocks on them, believe it or not, and you're going to start looking at that clock. I'd rather you read a book. I read cookbooks sometimes in the middle of the night. I'll look at a magazine, do some stretching, something where it's ideally not tied to social media, a screen, because that can cause you to stay up more. But do something just to pass the time that's quiet, calm, relaxing, and dim light so that it doesn't make you stay in bed worrying, trying to force sleep to happen. When you get sleepy again, go back to bed. So those are all my kind of top tips when it comes to those 3 a.m. awakenings. But first things first, get rid of that clock. It's not helpful. You might just be making an issue out of something that's a normal awakening. And if you let go of the clock, you might fall right back asleep. Our second question comes from Danny F. of Montreal, Canada. Love Montreal. I haven't been there in a number of years. I got to get back. Hi, Danny. So Danny asks, what are your thoughts on sleep medication? Can I get off of it if I've been on it for decades? Sleep medication has its place. It definitely does, but it is for the vast majority of people, not the first line treatment for insomnia. Because what we find and all the medications are a little bit different, but what we find with most of them is there can be daytime sedation. For some of them, there can be issues with sleepwalking, sleep eating. There can be issues with memory for some people, even things like Benadryl. Right? ZQuil, any of the diphenhydramine creating products, we know that there can be a greater risk for falls and accidents the older you get. So we really try to stay away from sleep aids, sleep medication, especially as a first line treatment. So I don't have an initial issue with it when people ask me about it, but using the word initial again, it really for most people should not be the first thing that we try. So that being said, the second part of the question was can I get off of sleep aids if I've been on it for decades? And I will be the first person to tell you that for many people, yes. This is something that I do day in and day out in my practice, whether it's medications that are off-label use of some antidepressants that are old school. There are patients who've been on those for 20, 30 plus years, some of the newer medications, some of the benzodiazepines. I mean, there's so many different medications out there, but I will tell you, I have seen it time and time again. Many people can get off the medications. And usually what we do is we combine the taper, with a very knowledgeable professional who does the taper. Usually it's the person prescribing. We like to, depending upon the medication, we do it slowly. And we combine it with CBT for insomnia or sometimes ACT therapy for insomnia. But we do some sort of cognitive behavioral treatment for insomnia that is evidence-based. And you combine it with the taper of the medication, and it can work for many people. I'm one of those people that is always a fan of trying to get people off the medication. That's what I do for a living. That's what I wrote my book about. I'm passionate about it. But I'm also passionate about helping people to see that they don't necessarily need to be on daily medication or on the highest doses of the medications. Because a lot of people, when they go to their doctors, understandably, they are in distress because they're not sleeping. So what do? They're in distress. They ask, can I get something that will guarantee that I will sleep? And the physicians will often write for, not everyone, but many will write for a higher dose to try and just help that person sleep better, because you feel for them. I feel for people. I mean, when I don't sleep well, and I'm not perfect with my sleep every night, it's hard. So we want to help people sleep, but sometimes people start on the highest medication dosages when actually they could have probably slept better or fine, same, on a lower dose just as well. So I'm a fan of no medication or getting someone or helping someone to be able to sleep on the lowest dose possible and as infrequently as possible. And yes, it can be done. Don't let anybody tell you that it can't. I see it all the time. So our third question, I got this one a few times recently online. Our next question comes from Joan K. of Portland, Maine. I also love Portland, Maine. They have really great restaurants there. I haven't been there in a few years either. Hello, Joan. Thanks for your support, and thank you so much for listening. Joan asks, "What are your thoughts on adults sleeping with stuffed animals?" It's so interesting. There was a whole article last year, I think, in the New York Times about it. I am one of those people that's just like, you do you. Like, unless it's creating a problem for you, a problem in relationships, fine. Okay, maybe you want to work on it. But if it's something that brings you support, it brings you comfort, go ahead. I mean, there are people who are going through a breakup, who had the loss of a loved one, whose significant other passed away, and that stuffed animal just brings them support. Why should I have to tell them don't do it? I don't think there's anything problematic with it unless it's causing a problem for you in your life or in your relationships. But otherwise, if you're fine with it, you do you. And our final question comes from Jim F. of Tampa, Florida. Jim, thank you really for this question. It's an important one that people don't often talk about. So Jim asks, what are your thoughts on PTSD or post-traumatic stress disorder and sleep? I don't know where to start for my treatment. It's a really, really common one. So one of the things that we see when people have been through trauma and they have post-traumatic stress disorder, so there's a re-experiencing of the symptoms, there's flashbacks, a lot of times with patients who are having PTSD, as well as the mood disruption, there's avoidance of the things that might have started or triggered the episode for them. So they might, if there was a trauma or a car accident, let's say just randomly that happened on some street somewhere, you might avoid going to that neighborhood or to that street. For some people or many people, a very hallmark symptom and that re-experiencing is also disturbed sleep. So it can be insomnia at night, and also nightmares are a really big symptom of that. So a lot of people are very lost when it comes to their treatment. So I think that we have to think about post-traumatic stress disorder, PTSD, from a multi-pronged approach. And prolonged exposure, PE, is a very effective treatment that we have for PTSD. It's a behavioral treatment, a kind of behavioral treatment for it, and it's really, really effective. So you could look at prolonged exposure. We also have medication interventions that can be really, really useful. But what we also find a lot of times is that even if you work on the PTSD symptoms and they're getting better through medication, prolonged exposure, whatever the treatment is that you're doing, even EMDR, we have good treatments for it. If you work on that stuff, and happens even with depression and anxiety too, the sleep issue tends to be that sticky symptom that doesn't always resolve on its own. So insomnia and nightmares. And a lot of times when it comes to PTSD, the nightmares wake someone up or are so disturbing to them that they start to fear sleep. So that fear of sleep then creates insomnia. And then the less sleep that you get, that makes your sleep more unstable and can cause more more nightmares again on top of insomnia. So what we recommend there is, I definitely would say, seek help for the PTSD, whatever mode of treatment that you want to go, but don't ignore the sleep symptoms. So maybe looking into someone who could help you with any of the insomnia treatment, nightmare treatment. So we've talked in the past about imagery rehearsal therapy for nightmares. We also there's medications like prazosin that can be really useful. So multi-pronged approach. I like to do things pretty much concurrently. So If you can get someone sleeping a bit better, help them sleep better, help them not have as many nightmares, you're going to be on such a better footing to get the most out of the other treatment for your PTSD. So think about it that way. And one other thing that often doesn't get discussed when we talk about PTSD is that there's actually a high rate of sleep apnea within this population, interestingly. So you want to think about if there's any pauses in breathing at night, any breathing disruption, snoring, anything that's going on, you want to get that evaluated too. So we do find that sometimes oftentimes treating your sleep apnea can actually help with some of the nightmares as well as any of the insomnia. But like I said, multi-pronged approach. So don't ignore any sleep apnea because people might just like poo-poo it, say, work on the other stuff first. But if you're on better ground with sleep, other things are going to have better outcomes in the long run. So I hope that answers those questions. Those were really valuable listener questions. I really do have the best listeners. So listeners, we always like to end with something to sleep on. One last point for anyone looking to change their sleep habits. Considering everything that we have talked about in the past year and a half, today, and like I said, past year and a half, that's 35 episodes. I can't believe I've recorded 35 episodes. I do have one final thought for you, something to sleep on. And that is, do not accept poor sleep as something that is just the natural part of life and that you will sleep one day and that it'll eventually get better. Do something about it. Definitely do something about it. And if someone tells you that it is normal to have poor sleep as you get older and then, that's part of life, find a better doctor. Do not ignore poor sleep. We start with all the stuff that we've talked about on this podcast, whether it's basic sleep hygiene, whether it's proper pillows, mattresses, making sure your sheets are comfortable, and then moving your way up the line. So if that's not enough after a few weeks, then we start thinking about talking with sleep medicine specialists who can really help you. Do not accept it as just part of aging because everyone deserves some good nights of sleep routinely. Thank you, everyone. Thank you so much for listening to Sleep Talking with Dr. Shelby. Our conversations over the last year and a half have been incredibly meaningful and so much fun. I hope you learned something and are sleeping better than ever. Remember to stay tuned for future episodes and bonus content. And in the meantime, go back and check out previous episodes you might have missed, from kids and sleep to insomnia, sleep apnea, even sleep hacks. We've made episodes really for everyone, and that was my goal. And I really hope you enjoy them. Thanks for listening to Sleep Talking with Dr. Shelby, a Sleepopolis original podcast produced by Ready Freddy Media. Remember, if you're tired of hitting snooze, hit subscribe or follow right now on YouTube, Apple Podcasts, Spotify, or wherever you're listening. And for even more sleep tips, visit sleepopolis.com and go to my Instagram page @SleepDocShelby. Until next time, sleep well.